नमस्कार, मैं डॉक्टर नवीन जोशी आयुष दर्पण के इस फेसबुक लाइव कार्यक्रम में आप सभी का बहुत बहुत स्वागत करता हूं। जैसा कि हम लगातार कुछ 5 या 6-7 सीरीज आप देख रहे होंगे जिसमें हम शल्य तंत्र के विशेषज्ञों को अपने साथ आमंत्रित करते हैं। जो कि अभी-अभी आप सब जानते हैं कि भारत सरकार ने शल्य तंत्र के आयुर्वेद के शल्य तंत्र के विशेषज्ञों को सर्जरी में कुछ विशेष सर्जरी का अधिकार दिया है। बहुत सारे लोगों के अंदर ये भ्रांति है कि आयुर्वेद में सर्जरी नहीं होती है, क्योंकि इस प्लेटफॉर्म पर आयुष दर्पण के इस प्लेटफॉर्म पर बहुत सारे आयुर्वेदिक चिकित्सक भी हैं और बाहर के भी लोग हैं। दुनिया के बहुत सारे देशों से लोग जुड़ते हैं जो हिंदी समझते हैं। हमने ये प्रयास किया है कि हम आपको ये बताएं कि आयुर्वेद में बहुत पहले से सर्जरी होती आ रही है। कल आपने एक लेक्चर देखा था जिसमें बहुत ही अच्छा प्रेजेंटेशन था, जिसमें आपने आयुर्वेद की सर्जरीज देखी थी। तो आज हमने अपने साथ आयुर्वेद में लोग सवाल करते हैं कि एनेस्थीसिया कहाँ से आएगा, आईएमए अक्सर ये सवाल करती है। तो आज हमने संज्ञाहरण पे ही अपना लेक्चर रखा है और हमारे साथ बनारस हिंदू विश्वविद्यालय से प्रोफेसर डी.एन. पांडे जी जुड़ते हैं जो संज्ञाहरण विभाग के विभागाध्यक्ष हैं। इस सेशन को मॉडरेट करेंगी डॉक्टर शीतल असूतकर। तो इससे पहले कि ये लेक्चर प्रारंभ हो, मैं डॉक्टर शीतल असूतकर को हमारे आज के मेहमान का परिचय देने के लिए आमंत्रित करता हूँ।
धन्यवाद नवीन सर जी। मैं जैसे कि अभी आपने कहा कि हम ये जो सीरीज चला रहे हैं तो इसके अंतर्गत बहुत से सवाल जो उठ रहे हैं एक सर्जरी गैजेट के परिप्रेक्ष्य में जो गवर्नमेंट ऑफ इंडिया ने हम लोगों को एक गैजेट जो पारित किया है हमारे फेवर में, तो उसके अंतर्गत जो एक 58 सर्जरीज की परमिशन हम लोगों को मिली है, उसी के चलते एनेस्थेसिया के ऊपर काफी सवाल जो उठ रहे हैं, एक जो उठाए जा रहे हैं रादर वी कैन से, तो और पर्टिकुलरली जो एक आईएमए जो एक एनजीओ संगठना है आईएमए नाम की, जो उसके द्वारा जो है वो कुछ भ्रांतियां निर्माण की जा रही है कॉमन पब्लिक के एक प्लेटफॉर्म पे बोलिए या एक जनरल जो पब्लिक के बीच में कंफ्यूजन फैलाया जा रहा है। तो उसी के चलते हमने ये जो सीरीज चला के रखी है आयुष दर्पण फाउंडेशन के प्लेटफॉर्म पे, जो कि हम some stalwarts from the field of surgery in India we are inviting on this forum for their expertise and for their expert orations and expert deliberations in the view and perspective of the surgery gazette and surgery in Ayurveda। उसी सीरीज में आज हमारे बीच प्रोफेसर डॉक्टर डी.एन. पांडे जी मौजूद हैं। सर आपका बहुत बहुत स्वागत है इस फोरम पर। मैं सर डॉक्टर शीतल आसुटकर मैं आपका स्वागत करती हूँ बीइंग मॉडरेटर ऑफ योर सेशन, एंड एज वेल एज वी वांट टू लिसन टू यू सर। आपके जो व्यूज है एनेस्थेसिया के बारे में और सर्जरी गैजेट के बारे में उनको हम सुनना चाहते हैं सर आपके मुख से सर। तो आज का आपका टॉपिक जो है आपने जो हमें दिया हुआ है आपके डेलिब्रेशन का, दैट इज स्कूल ऑफ इंटीग्रेटेड एनेस्थेसिया, दैट इज संज्ञाहरण, which is the gateway to surgical disciplines of Ayurveda। So Professor Dr. D.N. पांडे सर का जो है डेलिब्रेशन अभी सर का एक संक्षिप्त परिचय में देना चाहती हूँ, बल्कि मैं ये कहना चाहूंगी कि जैसे कि सर को तो जरूरत नहीं है परिचय की, सर आपका बहुत बड़ा नाम है, हमको पता है संज्ञाहरण और एनेस्थेसिया के क्षेत्र में एमएस BHU से। फिर भी मैं एक हमारी जो फ्रेटर्निटी है पार्टिसिपेंट्स की और जो स्टूडेंट्स है इस फील्ड के नए न्यूली अभी जो हमारे क्षेत्र में जुड़े हैं, उन सबके लिए मैं एक ब्रीफ बायोडेटा आपका पढ़ देती हूँ सर। तो डॉक्टर देवेंद्र नाथ पांडे सर, सर का बेसिक क्वालिफिकेशन है BMS डिप्लोमा इन योगा, MD आयुर्वेदा इन शल्य तंत्र एंड PhD इन शल्य संज्ञाहरण। सर जो है वो प्रोफेसर एंड फाउंडर हेड डिपार्टमेंट ऑफ संज्ञाहरण, फैकल्टी ऑफ आयुर्वेदा, इंस्टीट्यूट ऑफ मेडिकल साइंसेज, बनारस हिंदू यूनिवर्सिटी वाराणसी में है सर। और सर के एकेडमिक क्वालिफिकेशंस दे आर वेरी स्ट्रॉन्ग। सर जो है वो सर का जो है वो एकेडमिक एक्सपीरियंस जो है वो काफी रिच है सर का, और जिसको कि हम कहेंगे सर हमारे सीनियर मोस्ट फैकल्टीज में से हैं, और काफी ही इज अगेन द टीचिंग एक्सपीरियंस जो है वो तो 32 इयर्स का है सर का। देन ही हैज गाइडेड पोस्ट ग्रेजुएट students and then PhD students, that is 30 and 12 respectively। then सर के बुक्स पब्लिश्ड है, सर के काफी पब्लिकेशंस है, इनमें से कुछ संज्ञाहरण से रिलेटेड बुक्स है सर की, जैसे कि संज्ञाहरण प्रकाश जो है वो सर की बुक है संज्ञाहरण, दैट इज एनेस्थेसिया। देन अनुशस्त्र कर्म then आपदा प्रबंधन, शल्य तंत्र, शल्य सुहासिनी, integrated Ayurvedic pain management. Then सर का जो है वो under publication कुछ books है, जैसे कि one on शल्य तंत्र, then one under publication on संज्ञाहरण for PG, then there is a संज्ञाहरण शोध, an international peer reviewed. सर की जो sir is the chief editor of this particular journal, that is संज्ञाहरण शोध on international, which is an international peer reviewed journal, and many more. Sir sir has been associated with many more such journals. Then sir has published many papers, and nearly about 130 paper publications sir has done, and attended many conferences and national seminars and workshops, and international contributions even sir is having. Then sir is life member of many reputed organizations and associations like NEMA and All India Science Congress, Research Society of Clinical Anesthesia, Association of Anesthetists of Indian Medicine, Sushruta Association, Indian Association on Palliative Care, Indian Society for Study of Pain, Indian Ayurvedic Teachers Association, All India Ayurveda Physicians Association, and many more. And sir का जो है काफी contribution है field में. He has been the recipient. He has been the guest speaker on certain coveted forums for like Tirak Ayurved College Pune, SDM Ayurved College Udupi, GB Ayurved College Puri, SNS University Varanasi, FFDC Kannauj, and many more. Sir has organized workshops and conferences. Sir has received many awards. Of them, there are certain to be presented here, to be told here, like Rajiv Gandhi Medical University has Karnataka has felicitated sir in the 4th National Conference of AIIM. Then he has received Dhanvantari Award, and then received Ashwinav Award in 2000, which is a prestigious award. Then he has given orientation to many refreshers and coordinator at PAT 13, PAT 17, and AIPG ET 15, and many such contributions sir has given to the field. So without wasting more time, I would like to just call upon sir and hand over mic to you, sir. We are very much eager to listen to you and your views. Over to you, sir.
Thank you, Professor Sital, and good evening to all the senior of Shalya, Shalak, Prasuti, Balrog, and all the Ayurvedic specialties presenting here, and especially to Professor S.C. Vasne and many person who I can't see on the our platform, but I
Sir Anup
want
Batra,
to.
sir is present. He is campus director in Rishigul campus. Dr. Bholanath ji, Vaidya Amar Dwivedi is from DY Patil Ayurvedic University, Mumbai. As
Thank you.
Ajay Sharma ji and Rajesh Kumar Gupta ji, Dr. Sandeep, and many more are again joining in this session. And this session is already live in Facebook, so many of the participants will join in Facebook also. Yes, sir.
Thank you, and my good evening to all of presenting here on the platform. And I am delighted to present my views, to share my views with all of you. I will use bilingual, Hindi and English mix, and we will comfortably talk. And I think that there will be some useful. I will start with my first with a story, short story before the presentation. That is, my screen is visible. Hello?
Share your screen, sir.
I have already shared.
No, sir, it's not shared. Yeah.
No, okay.
Yeah, now
Not
shared.
okay.
Now shared. Yeah. Yeah.
So this is a story before we will come to the main topic.
Sir, please do it full screen, sir. Please. Full screen.
Okay.
Yeah.
Okay. Now it is fine.
Yeah, fine.
Next. Slides are visible? Hello?
Sir. Yes, sir. Visible, sir.
Okay. So now I will come to the, before starting, I have show this story because we have to be a clear mind without biases, then we can understand each other, allopathic, Ayurvedic, or any system of medicine, any knowledge. We can understand when there will be clarity, there will be no differences, there will be no biases. So I will start from Sangya Integrated Anesthesia, the gateway for the surgical discipline of Ayurveda. Sometime I will use that, the gateway for the development of Ayurveda. So this is true. I will discuss about biases. What are surgery and Sangya in Ayurveda? There are many confusion in the many academicians. Even in Ayurveda, there was confusion that if there is surgery in and Sangya in Ayurveda. In our university, also many persons are not aware of this. But nowadays, this is a wave, and everyone in India, I think, know that there is surgery in Ayurveda, and I am opposing it. Then in our Ayurveda also, there is very confusion. Why surgery? Why not only Shuddha and Ashuddha Ayurveda? This is also a very conflict amongst us. And within the surgical discipline, there is also a war between surgical disciplines and Sangya, where this is in existence. And even then, I will say that Sangya is a gateway for surgical disciplines. I will start from the vision and mission of Bharat Ratna Pandit Madan Mohan Malviya ji. Bharat Ratna Pandit Madan Mohan Malviya ji dreamed to establish Ayurveda as a total health system in pre-independent India. He established Ayurveda College in Banaras Hindu University with an integrated course curriculum. The Ayurveda College, Banaras Hindu University, was started in the year 1922 in the premises of Faculty of Oriental Learning and Theology, and further a separate Ayurvedic college was established in 1927 with a 6-year course Ayurvedachar with medicine and surgery. That was AMS. Bharat Ratna Pandit Madan Mohan Malviya ji mentioned in the vision document of Banaras Hindu University, of the Upavedas, particular attention will be bestowed on the Ayurveda. It will be brought up to date by the incorporation of the results achieved by other nations in anatomy, physiology, surgery, and other departments of the medical sciences. The ultimate aim of the department will be to provide the whole country with Vaidyas, well qualified, both as physician and surgeon. This was the dream of Mahamana. A botanical garden will be maintained for the culture of herbs and roots for medical use. Hello, my slides are visible? Hello?
Sir, your slides are visible, sir. But your mic is muted, sir.
Okay.
Yeah.
Yeah. Okay, sir.
So I should start from beginning?
No, sir. Okay, it's okay.
Okay. The ultimate aim of this department will be to provide the whole country with Vaidyas well qualified, both as physician and surgeon. A botanical garden will be maintained for the culture of herbs and roots for medical use, vegetable and plants for study of fiber, dyes and tans. This was the vision of Mahamana Pandit Madan Mohan Malviya ji. There will be laboratories for teaching and preparation of rasaj, tel, asav and other medicines, and for carrying on original investigation and experiment. The ultimate aim of this department will be to provide the whole country with Vaidyas well qualified, both as physician and surgeon. This was his dream. A botanical garden will be maintained for culture. This was, I have already said. Eminent graduates and licentiates in European medicine and surgery will be employed to give instruction and training to the students of Ayurveda and to help the Vaidyas in preparing works in Sanskrit and Indian vernacular. on anatomy, physiology, surgery, hygiene and other sciences auxiliary to the Ayurveda. This is I have taken from History of Banaras Hindu University, page 66, page 125. This was the seed of integrated health education, and thus Banaras Hindu University produced thousands of undergraduate and postgraduate trained in this integrated system. Banaras Hindu University now proved that it is a successful model of medicine for the entire world population. Only the need of the time is to be accepted it by the government and to frame an act to practice integrated system of medicine which is most beneficial for mankind. Chairman Board of Governors, CCIM New Delhi, to frame a new integrated course for health services of India. As an example, if anyone is suffering with acute pain in a remote area and there is no MBBS doctor, but there is a doctor of Ayush system, trained and taught in integrated system, who is competent as well as allopathic doctor, it is not unfortunate that the patient who need immediate relief, but the doctor of Ayush who can provide him immediate relief is not allowed by country law to prescribe a simple pain reliever and thus is helpless. The patient has to suffer with pain till the MBBS doctor is approached. Is this not a crime to the... Okay? तो बीच बीच में नेट चला जा रहा है. This is the problem.
Okay, sir. It's okay.
Okay. Okay.
अनम्यूट कर लीजिए सर, अनम्यूट कर लीजिए.
अच्छा, बीच में अपने आप म्यूट हो जा रहा है?
नहीं, कोई बात नहीं सर, अब नहीं होगा जी.
Okay. So this is an example that how the integrated practitioner can help in the periphery, in the rural area, even in the urban area where doctors are very few or in adequate number. A doctor should be able to provide. What is the aim of we doctors? A doctor should be able to provide immediate relief to his patient by any means suitable to him. In many conditions, Ayurvedic drugs cannot help, and in the same way, allopathy is also fail in many conditions. Therefore, integration is needed. Turning point. Now, after 73 years in independent India, we have to decide what we want. Ayurveda as a total health system with a strong Ayurveda including recent 22 branches as per Gazette 2005 with the vision of our visionary, the then advisor Dr. S.K. Sharma, or Ayurveda as a market of massage center, spa and Ayurvedic kitchen, Ayurvedic nutritional foods. If our choice is number one, then we have to frame our country law in favor of integration with teaching and training, which is already continued since 1922 in the Banaras Hindu University, and where the graduate and postgraduate are serving in the institution, they are providing this integrated training in all the corners of the India. If our choice is number two, then we have to frame our country law in favor of Shuddha Ayurveda and to stop teaching and training of all the surgical branches, because these all can be practiced by physicians. There is no need of these all 14 departments. 14 departments were framed with the vision of integration and to support Ayurveda as a total health system, which will not be fulfilled with option number 2. National scenario, there is conflict of interest. Interest of government is earning foreign currency, and interest of Ayurvedic pharmacy is to earn money from international and national market. Thus, Ayurveda is known internationally as complementary, alternative, supplement medicine, not as a total health system. International scenario, monopoly of Western medicine and multinational pharmaceuticals companies do not like to make space for Ayurveda as a total health system. They do not consider Ayurveda as a medicine. In our own country, what is the scenario? All the 8 parts of Ayurveda, Ashtanga Ayurveda is not nourished equally, and even the Ayurvedic postgraduate in surgical branches are deprived from practicing surgery. Only Charsutra was allowed to practice. Now I will come to some facts in favor of Ayurvedic surgeons. Sushrut Samhita is considered an oldest book on surgery. Sushrut is recognized as the father of surgery, father of plastic surgery. Several surgical procedures are mentioned in Sushrut Samhita, which all are known. These were permitted by the then king Rajagya. With Rajagya they were doing. Instrument mentioned in Sushrut Samhita. These all, you all know that there are 101 yantra and 20 shastra which are practiced even today also. There is wound management, and these sloks prove, these references prove that there was a very good management of wound at that time. And the Vagna management, which is described in Sushrut Samhita, is now today also practiced, and this is very fruitful and very practical today also in the modern medicine, the allopathic system. They have incorporated all these by any means. I will not say anything on that side. Plastic and reconstructive surgery, there are beautiful references how they performed, what were the principles of plastic surgery. Gandha utpatyamansena sanubandhena jivita karnapalim apalestu kurya nirlikasasri. This is all in Sushrut Samhita. Practice of different type of surgery for Asmari and Earth. A very good standard practice and practical knowledge of different type of surgery for Asmari, Earth. He mentions the specific indication of different type of 8 type of surgical procedure. I think these all were discussed already. There is emergency management also. Kriyayam dhruvo mrityu kriyayam sanshayo bhavet tasmat priksha kartavyam miswaram sadhu karinam. There is very good message for incorporation of learning of many disciplines, many specialties, the knowledge of many specialties with theoretical and practical knowledge. Yatha kharas chandan arvai bharat savetta natu chandanasya evam hi shastrani bahunya ditya charthe sumudha kharvad bhanti. This was the principle, this was the foresight of our ancestors. They how did all this surgical procedure with very high morals. Salya duvidam anavaddam avavaddam cheti sauryam asu kriya sasta chanim asved avepatu asammu asabedya savaskaram. These all are mentioned in Sushrut Samhita. Trividha karmam, puru karma, pradhan karma, paschat karma. There is also mentioned about mood garvo udararso asmari bhagandar mukharoge bhuktavat. Bhuktavat karma kurma. There was the nil orally. He mentioned the concept of nil orally before surgery. They also mentioned about Sangyaharan. How prak sastra karmadas chestam bhojayet aturam visak madhyapam payena madhyam tikshanam yovedanasa. This was the reference which clearly said that they were known, they were practiced to Sangyaharan. Without Sangyaharan, surgery is impossible. Now I will come to the surgery today. What is surgery today? Present day advancement in surgery is due to advances of tools, technology developed by physics, a branch of science, computer and electronic science. Present day advancement in anesthesia is due to advancement in the field of physics, chemistry, computer and electronic science. No doctor, either allopathic or Ayurvedic, has invented in these 28th or 19th century. These all are invention of science. All the devices are invented by scientists to facilitate the surgery and anesthesia. Thus, question arises, why Ayurvedic surgeons are deprived from surgery? Why Ayurvedic anesthetists are deprived from anesthesia practice? The world is progressive and using his other invention for betterment of mankind. This is truth. But only Ayurvedic surgeons are deprived from practicing surgery due to hindrance of IMA, which is controlled by Western world. There are only 1%, very few persons are in IMA who are opposing. Many are our friends, many are our well-wishers. They are patriots, they are nationalists, and they never support this vision. But some people who are opposing and who are in Supreme Court or any other means, they are even not introduced with Susru Samhita, Charak Samhita, Bhagavad. If they will learn any time, if they will study these books, they will be proud of our treasure, and they will also start to think as like we, because they are Indian, no, they are not Britishers. Surgery is our ancient wisdom, and we are equally beneficiary of newer development in the field of science. Now I'll come to the point, the key role of Sangyahan in the development of different branches of Ayurveda. I will see Shall-Tantra. When Professor P.J. Deshpande started to revive the surgical discipline, at the same time he incorporated Sangyahan, radiology. He was multidisciplinary knowledgeable person. He was surgeon, he was radiologist, he was anesthetist, he was wrestler also, and many things were God gifts to him. And this was the vision of that time. Our ancestors, teachers, Professor L.M. Singh, Professor G.C. Prasad, K.R. Sharma, S.N. Pathak, Dr. S.B. Pandey, they thought that without Sangyahan, without radiology, we cannot restore surgical discipline. And they founded the section of Sangyahan with a very inadequate staff, inadequate hand, but they started. And due to this, the many surgery were done, and even today is going on in Banaras Hindu University. With this vision, they appointed in Salashalakya a person like S.B. Pandey, F.S. Gundavia, who were the first anesthetists in Banaras Hindu University for the medical science also, for the medical college also. They introduced anesthesia. They trained the modern MBBS during their MD period in the starting time. And very long, since 1995, this was in, a collaboration was continued. Shall-Tantra Char Sutra therapy is recognized globally now. It cannot be performed without help of Sangyahan. Anybody say that I am doing without help of Sangyahan? This is not true. Char Sutra application in heaven is a very small track, is not possible without pain. Everyone will like a painless procedure, and thus Sangyahan is required. For different minor, moderate and major surgical procedures required Sangyahan. During these procedures, sometimes shock may be faced and Sangyaharak will be required to resuscitate. Post-operative period also it may happen and Sangyaharak will be required to resuscitate. And this is the main thing. This is the main target. This was the main reason due to Banaras Hindu is surviving till date with its integration, teaching and training, which was not at the other centers. This vision was not adopted. Many centers may be equally benefited since then, but they never thought like this. हमारे ही जो प्रोफेसर्स बड़े बड़े इंटरव्यू लेने गए, वो चाहते तो आज हमारे पास 100 एनेस्थेटिस्ट हैं, उनमें से कम 100 जगह वो तो होते ही एक एक करके, लेकिन उन्होंने एक जो अपनी स्टूडेंट प्रेम, स्पेशलिटी प्रेम, जहाँ इंटरव्यू भी लेने गए संज्ञाहरण के अच्छे से अच्छे स्टूडेंट्स को उन्होंने चेयरमैन को ये कहा कि ये संज्ञाहरण का है, जबकि ये सब स्पेशलिटी थी सर की, उन्हें अपॉइंट नहीं किया. नहीं, आज कम से कम 100 इंस्टीट्यूशन के पास संज्ञाहरण के लोग होते. This is the reason also due to which we are lacking, and the IMA people are saying, how you will perform surgery when you have no anesthesia? They don't know. They know that only Banaras Hindu University is providing training, as some 2 or 4 other centers are providing training in Sangyahan. But due to ignorance of our teachers, our seniors, I will not hide this fact that due to our gurus also, this thing is happened. If they thought as like they were thought about their own center, Banaras Hindu University, many more places as like Jamnagar, Jaipur, you know that in Paprola there is our Sangyahan, there is surgery is going on. In the Guwahati there is our student surgery is going on. At the center where Sangyaharak are available from our own origin, those center are flourishing surgical discipline in a better way, in a good way, because they can perform surgery with confidently, with their own people. Why we started Sangya and Banaras Hindu University? Why this was? There was a very good department of anesthesiology, because our guru were known that once the time will come, they will raise their hands that no, we will not provide anesthesia to Ayurvedic surgeons. And this is the reason they started this course, they prepared their team for anesthesia, which was not happened in all the corners of the country. And we are the defaulter. We are the as like Salakya Tantra, we have enriched heritage of many procedures mentioned in Susrut Samhita. To practice the procedure, Sangya is an essential part. During these procedures, sometimes shock may be faced and Sangya Harak will be required to resuscitate. Post-operative period also in many it may happen and Sangya Harak will be required to resuscitate. Now, coma referee, Sangya Harak services are required for cannulation, NICU, central line, resuscitation, Kaya Chikitsa, for Panchkarma. Even during Panchkarma there may be emergency and it should be required the resuscitation. The CCU can be started in Kaya Chikitsa for cannulation in Murcha, unconscious patient, Atteik Chikitsa, central line and resuscitation. These all are required even in Kaya Chikitsa also. And what is the role of Draviguna Rasas? There is a lot of scope of research for Draviguna Rasas specialty regarding Ayurvedic pre-medication, Ayurvedic analgesic, Ayurvedic post-operative care medicines, Ayurvedic sole agent for anesthesia. This is not our part. We are service provider. We are not responsible that there is no sole agent in Ayurveda. We all the 8 branches of Ayurveda should explore the possibility to get any sole agent. But I do say that this is not required because world is very forward, very advanced, and there are very advanced medicine, very safe medicine. Why we are deprived to use that sources? This is not a sin which we are going to do. We are going to do for our patients, our life patients, not for anybody others. Now I will come to the Upsami Chikitsa, palliative care. Sangya services are required for critical ill patients, malignancy, CCU, for cannulation in unconscious patient, ICU, central line, and resuscitation. There is another field, chronic pain management, integrated method, PNB with Agnikarm, Jaloka, Vacharan, and Siraved, pain management, Ayurvedic clinic, palliative care, Ayurvedic clinic. These all are with in our campus, in our premises of Banaras Hindu University SS Hospital. What were the newer development in the department of Sangya? We started workshop of 7 days, every year 3 times, cardiocerebral resuscitation for eyes practitioner. First workshop was started in 2000 and since then we have arranged 60 workshops. More than 500% from all over the country were trained. CCPR training was given to school students and Rotarians to Central Hindu boys school, girls school, and many more schools. Boys were trained for this CCPR. We have published a book on CCPR. We now started a 6-month certificate course on CCPR and first aid at university level in is started from 2020. 1 year full-time certificate course of Natyayik Chikitsa intensive care is started from 2020. 1 year full-time certificate course is Ayurvedic pain management was started from 2016. 2 years full-time diploma course in Ayurvedic pain management started from 2020. So now we have 6 courses, but sorry to say that MD Sangya Haran was discontinued since 2016. This is very unfortunate, which was done with a very difficult, very tough efforts of Banaras Hindu University and the then advisor Dr. S.K. Sharma and many more to start 22 specialty, in which the main 2 specialties were Sangyahan and radiology. But unfortunately, during 2016 Gazette, these 2, not only 2 but 6 specialties were discontinued due to unknown reasons. But this is very unfortunate. This should be restored. And Sangyaharan is the gateway for the surgical discipline. Sangyaharan not only to anesthetize the patient, but it is manifold. Sangyaharan is known for anesthesia. Sangyaharan is known for integrated pain management. Sangyaharan is known for integrated palliative care. Sangyaharan is known for integrated critical care. Therefore, Sangyaharan should be taught and to be trained by Sangyaharak in each Ayurvedic institution at UG and PG level, so that we can produce the number of hands for all the above facilities. The central and state government should frame new act in favor of legalize the practice of integrated medicine. Thus, Ashtanga Ayurveda will be total health system and will serve the world population. Ayurveda is based on Ashtanga, which is consisting of Shalya Shalaka and Prasuti Tantra. Ayurveda is preventive as well as curative. Integrated graduates and postgraduates should be allowed to use modern tool and technology, including recent development in medicine, to restore our own surgical heritage, Shalya Shalak, Prasuti Tantra and Komarvrit. Last but not the least, Sangyahara is integral part of surgery, and its role is significant for advancement of Shalya Shalak, Prasuti Tantra, Komarvrit. Therefore, I will pray, I will appeal, then we all should make effort to restore Sangyaharan, and we radiology also, and the other specialties which were discontinued also. They are beneficial for all the Ayurveda and all over the country. And I would like to say something about our guidelines for effective anesthesia practice by integrated approach. What is our integrated approach at our center? As like we have made a protocol preparation of patient. If patient permit and the case is scheduled in a routine list, Sreyan, Swedan, Baman, Virechan and Basti may be implied as per prakriti of the patient. Routinely breathing exercise, Anulom and Vilom be advised. 3 days before operation in the night, Dasmul Quad, 150 cc and 50 cc Mahanayan Tail Basti be implied. 2 days before operation in the night, 50 cc Mahanayan Tail Basti to be implied. In the night before operation, Mirdu Virechan is implied. It is noted that Basti and Virechan are contraindicated in the GIT operation. This should be kept in mind. Pre-medication for GA, 90 to 120 minutes before anesthesia, we use indigenous Ghansattva of anyone. We have worked on Brahmi Ghansattva, very good sedative, Ashwagandha Ghansattva, Jatamansi, very good, very fantastic result. With a sip of water, 10 to 20 ml with injection glycopyrrolate, 0.2 mg IM before anesthesia. And for regional anesthesia, we can give indigenous Ghansattva of anyone, Nirgundi Ghansattva. These are post-operative analgesic. This will be useful. Parijat Ghansattva, Rasna Ghansattva. These all are with our gone through our experimental and clinical research work. With a sip of water with injection glycopyrrolate, 0.2 mg IM before anesthesia. And the Pradhan Karm, as you know, IV induction, the same as like in modern medicine, pre-oxygenation, thiopental sodium with scoline or propofol and scoline or ketamine scoline. This is, and the ZA, volatile induction with oxygen nitrous oxide, volatile and scoline, maintenance with intermittent positive pressure ventilation, with endotracheal intubation, and with non-depolarizing muscle relax narcotic analgesia. These are, this we have to use, and this is not the property of modern medicine. I can say that these are the advancement of science, tools and technology. These are the products invented by any chemist or any other person, not by any modern people, modern doctor. Recovery, glycopyrrolate, neohistamine as usual, we can use. This is not sin. And the paschatkarm, IV fluids till normalization of the physiology, oral diet, peya, vilepi, mand as like advice in our Susur Samhita in during condition of recovery, maintenance of BP pulse, respiratory rate, body temperature, motor activity and senses. These all should be observed during post-operative, and after 3 days, mild basti, mild viration after 4 days, anulom vilom, breathing exercises. These all are in practice in modern medicine also. And we have also this treasure. Only the thing that we have no sole agent, but we are deprived at that place also. We have opium, which is the father of analgesic. Ether is from Kevada. But this is very expensive to start to prepare ether from Kevada. Final assessment of those dhatu and prakriti required. If all is well, patient may resume his normal work. Now we'll come to why Sangya was discontinued. There is due to government weakness and ignorance. I have no hesitation to say that this was the ignorance and weakness of our government, and now the government is very strong, and it is published, it is gazette, and I think that our government will not go to back foot, and the target which we wanted since last 70 years is now achieved by our Ayush ministry and our this bold government. Due to our own people, as I have mentioned, our old people were not prepared to give space to Sangyaharan in their specialty. Shalya Shalakya and Prasuti and Balrog department, if desire that one post will be for Sangyaharan in our institution, they can manage. In this Prasuti Tantra department of Banaras Hindu University Faculty of Ayurveda, done like this. They appointed a lecturer named Prasuti Tantra, which degree Professor K.K. Pandey joined, and this can be done at any other institution, but it was not done. Chances were there, our experts were there to select any Sangyaharak in their Salya discipline or Salakya discipline, but they don't bother. They were ignorant. They were not thought that this will be benefit for the old departments, and they see the very, मैं कहता हूँ बहुत बड़ा पाप है जो उन लोगों ने, बड़े सीनियर्स लोगों ने बैठ के किया, बहुत अच्छे अच्छे स्टूडेंट्स को चेयरमैन के कान में कह के कि सर डिग्री है लेकिन ये संज्ञाहरण वाला है. मोनोपोली ऑफ एलोपैथिक सिस्टम, दिस इज ऑल्सो the negative point. Due to egoism, negligence attitude of surgeons of Ayurveda, I have no hesitation to say, आज जो वेव है, आज जो स्पिरिट है, ये स्पिरिट 70 इयर्स पहले क्यों नहीं थी? जब से बनारस हिंदू यूनिवर्सिटी हुआ उस समय से जामनगर और जयपुर ने क्यों नहीं किया? Why they? Because they were ignorant. There is no zeal to do perform surgery. आराम चाहिए, काम नहीं करना है तो हमें आना है. हमें भी सरकार रोक रही है, लेकिन हम लोग एक मिशन लेकर है बनारस हिंदू यूनिवर्सिटी महामना मालवीय जी का, और हम करते हैं. With this, that we will take the responsibility. We will take the risk for better teaching and training of our students. But we are failed when they are going outside the boundary of Banaras Hindu University. Due to no employment of Sangyaharak, as like I have mentioned, practicing anesthesia with modern surgeons. They are practicing with modern surgeons and facing legal problems. this was also problem of discontinuation of Sangyaharan. And these all should be managed in the present scenario. Then only we will be successful to perform the 58 surgery. If we will do as like our ancestors done, as like our seniors done, nobody will help us. Surgical disciplines will die. There will be rudimentary. Only we will perform Agnikarn, Jalauka and Siravyad, others, because they, IMA people are not bothered for this. You can do. The bread butter where they are feeling competition is surgery. When we will start to cut, there is the competition. In the Banaras Hindu University, there is no competition. In the surgery department, there is 0% person there who want that Salya people should not perform surgery. But other places it is. Why? Because of the competition due to the bread and butter. In the anesthesia in the Banaras Hindu University, there is competition. The teaching and training which were in collaboration with modern anesthesia, this was now discontinued due to this bread and butter fight. So what is the solution? Restore government order in favor of Sangyaharan and Chaya Vikiran so that the specialties like Salshala, Prasutit and Balrog can provide adequate teaching and training to the UG and PG scholars. Our aim is, as an academic institution, to provide adequate teaching and training. There should not be permitted any new college without Ayurvedic anesthetists or Ayurvedic radiologists. The practice of these branches can be effectively done after a proper teaching and training. This is a challenge for us. This is a challenge, not for only us, for the government also. The government has faced the music of IMA, and because these all are in the interest of our public, the country of India, this is the interest of country, our own country. And the government should take lead. This government is, I can say that, the nationalist government. If this government will not take lead and this will not provide us legal favor, legal protection, no Shalya discipline, surgical discipline survive for the next 100 years. If we will defeat at this juncture, the next coming years will be very hopeless. And I pray God that हमारे लोगों को भी सद्बुद्धि दे, IMA को भी सद्बुद्धि दे. We are not enemy, we are friend. We are doing for the mankind. Bread and butter want everybody, and God सबको देता है, सबके कोई किसी से नहीं लेता है. जब हम लोग बनारस हिंदू यूनिवर्सिटी से निकले 90 में जब प्रैक्टिस करते तो बनारस के 4 कोनों पे 8-10 मेडिकल हॉस्पिटल प्राइवेट क्लिनिक्स थे. इस समय 150-200 हैं. एनेस्थेटिस्ट 8-10 थे, इस समय 150-200 हैं और सभी के पेट भर रहे हैं. ऐसा नहीं होता है. और क्वालिटी अगर वो कहते हैं कि आप सिखाया किसने जानते, मेडिकल कॉलेजेस के भी सारे प्राइवेट गवर्नमेंट एक स्तर नहीं है. वहां भी कोई 19, 20, 18, 15 सबके स्टैंडर्ड हैं. और सर्जरी तो वही करता है जिसको आता है, और उसी के पास पब्लिक जाती है जिसके पास. एनेस्थेटिस्ट को लोग वही बुलाते हैं जिसको सेफ होता है. तो ये चीज बीइंग ए डॉक्टर हमको या IMA को, नीमा को, सबको समझना चाहिए कि हम उतना ही करते हैं जितना हमें पढ़ाया जाता है, सिखाया जाता है. उनको MBBS में जो पढ़ाया सिखाया जाता है उस बेसिस पे करते हैं. हमें BMS में जो पढ़ाया सिखाया जाता है उस बेसिस पे करते हैं. ऐसे ही MD में जो, और ये गवर्नमेंट देती है. गवर्नमेंट इज authority. If government is giving power, license to do all these 58 surgery, why they have stomach? उनके पेट में दर्द क्यों है? There is only the problem, not for the public, but only due to bread and butter. उनको ये मंजूर है, उनके नर्सिंग होम्स में BMS, MD सभी सेकंड लाइन है. वो एक है, वहाँ 1 दर्जन वही मिलेंगे. सारे ICU और ऑपरेशन थिएटर, वो कहीं बैठे सिगरेट पी रहे होंगे और उनके सारे ऑपरेशन BMS कर रहा होगा. ये उन्हें मंजूर है, वो जानते हैं. बट इन द प्लेटफॉर्म, इन द कोर्ट, वो ये बोलते हैं इनके पास सुश्रुत की तरह से सर्जरी करें, अगर वैसे ही करना है तो वैसे ही एनेस्थीसिया है जैसे सुश्रुत ने दिया है। मतलब एडवांसमेंट का सिर्फ हक आईएमए या मॉडर्न मेडिसिन को है, आयुष को नहीं है। मैं कहता हूं हर इंसान को बराबर अवसर मिलना चाहिए ग्रो करने के लिए, और इस कंट्री को तो इंटीग्रेटेड अप्रोच की बहुत बड़ी जरूरत है, बिकॉज पॉपुलेशन इज सो ह्यूज। उनको मॉडर्न मेडिसिन, एलोपैथिक डॉक्टर्स हेल्थ केयर नहीं प्रोवाइड कर सकते हैं, और उनके लिए इतना बड़ा कंपटीशन भी नहीं है। ये आयुर्वेदिक डॉक्टर न्यूरो और कार्डियो और ये तो नहीं करने जा रहे हैं, they are simply going to perform the surgery which are allowed to them and which they are taught and trained. So therefore, this battle should be stopped, and we should approach with friendly, not with abusing language or very aggressively. And a day will come when we will be together, allopathy, Ayurveda, they will come. I am sure that they will come, that we will be at one platform. Thank you very much for patience hearing. Thank you.
Thank you so much, sir. एक बहुत ही ब्रॉड लेवल पर आपने संज्ञाहरण की उपयोगिता के साथ साथ आयुर्वेद में शल्यतंत्र की क्या उपयोगिता है और आयुर्वेद जगत का जो शल्यतंत्रज्ञ एवं संज्ञाहरण तज्ञ जो है वो हमारी पूरी देश की मतलब जनता के लिए कितना उपयुक्त साबित हो सकता है, ये आपने बहुत ही स्ट्रेट फॉरवर्ड वे में बताया है सर। एंड यू हैव राइटली सेड सर दैट एनेस्थेसिया इज द नीड ऑफ द आवर। विदाउट एनेस्थेसिया कोई भी क्रिटिकल केयर यूनिट या कोई पैलिएटिव केयर, कोई कैंसर केयर या इवन इमरजेंसी मैनेजमेंट जो है क्रिटिकल केयर में की जाती है, ये कोई भी केयर जो है वो नहीं की जा सकती है, इसमें हम सफल नहीं हो सकते हैं। या इवन आयुर्वेद के जो अष्टांग है जैसे कि काय चिकित्सा या बाल रोग या और भी जो इसके अंग हैं जैसे कि स्त्री रोग है और उसके अंतर्गत जो भी व्याधियां है, सर्जिकल डिसिप्लिन है, तो इन सभी में एनेस्थेसिया की या संज्ञाहरण की उपयोगिता है। सो इट्स अनफॉर्चुनेट दैट गवर्नमेंट हैज अपैथी टुवर्ड द संज्ञाहरण department of a reputed institute like IMS BHU, and unfortunately it has been stopped. So that is a apathy of government, and it should be taken in consideration while doing whatever amendments we need to do in this particular regard during this publication of this gazette or forthcoming whatever rules and regulations will be amended in the gazette. So maybe this is the need of the hour that government should think positively about the need of anesthesia in to and the training of training and teaching of anesthesia, that is integrated संज्ञाहरण to be given to आयुर्वेद पोस्ट ग्रेजुएट्स। सो संज्ञाहरण जो है वो आयुर्वेद में पोस्ट ग्रेजुएशन के रूप में एस्टैब्लिश होना बहुत जरूरी हो जाता है। तो ये आपने बहुत अच्छे से हम लोगों को सर आज के प्लेटफॉर्म पे बताया है। सो इट हैज कम फ्रॉम स्ट्रेट वे फ्रॉम द हॉर्सेस माउथ। सो आप जो कि सर इसके फाउंडर हेड ऑफ द डिपार्टमेंट रह चुके हैं संज्ञाहरण के, सो आपके श्रीमुख से ये बात सुनकर हमको बहुत ही मतलब इट्स एन आई ओपनर फॉर ऑल ऑफ अस। सो थैंक यू वेरी मच sir, you have been here and I'm very much thankful to you on behalf of Ayush Darpan Foundation of India। और बहुत से लोग हमारे साथ आज जुड़े हुए हैं, तो हम लोग मैं डॉक्टर नवीन जी को माइक हैंड ओवर करना चाहूंगी कि आप आगे का थोड़ा संभाल ले। डॉक्टर नवीन जी, हेलो डॉक्टर नवीन जी। So we have many stalwarts with us in the Zoom meeting itself. So if anybody wish to talk or if anybody wish to give some remarks on Sir Dr. D.N. Pandey sir's oration, so most welcome. Please unmute yourself, those who want to give remark. Dr. Amar Dwivedi sir, are you there? अच्छा, आप कर लीजिए सर। आई थिंक सर का जो है वो नेट इशू आ गया है, सो ही हैज बीन, सर जो है वो मीटिंग से बाहर हो गए हैं। सो इट वाज अ वेरी इंफॉर्मेटिव एंड वेरी आई ओपनिंग सेशन फॉर ऑल ऑफ अस, एंड ये एक बहुत अच्छा सेशन रहा है इस सीरीज में। So with this, all these concluding remarks he has given, and even whatever discussion we have done, so I conclude today's session. And thank you so much to all for being here, and thank you all for your gracing this particular function with all of your presence. Thank you very much.